jolted down in my lower back.
How's that numbness?
I don't feel it.
What was that?
I don't feel it now. I don't feel the numbness no more. That's amazing.
Good.
I think it's way better. It's like I can even move my arm now.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, obviously with reading over the paperwork, you've been doing some damage to your body. Construction worker for 35 plus years?
Yes.
Okay. And as you're telling me, for like 15 years you were laying brick?
Yep.
Had to stop doing that one though. But you're still in construction and still doing a lot of heavy lifting.
Yeah, a lot.
Okay. Chief complaint is what you told me. It's neck, well, everything is neck pain.
Right.
You've had a headache for years. It just depends on the day and the degree of the headache.
Right.
But there's always a headache there. You've just been living through it now. How long have you had like the headaches for?
Well, I was in an accident over a year ago, and
Okay.
ever since that accident, they have been more frequent. And
Okay.
but I've had headaches for years.
Okay. And now, along with the headaches that you've been having, it's neck pain that you've been getting, and that's through here. And then you've even been getting, what was it, like a numbness shooting?
Yeah, like a numbness, tingling feeling all the way into my shoulder right here.
Okay. How about the right side?
It's not as bad, no.
Okay. So on that left side, so primarily here, going into here. Now the headaches, are they like across the head, or what do you notice? Or are they just like a dull kind of
Just
throb?
like a dull, like throbbing. It's almost like a migraine.
Okay. All right, but it's constant and daily, so you're used to it.
Yeah.
Now you got some issues in the mid back, and then you said the low back's kind of shot.
Yes.
And as you're telling me, you have had the foramens cleaned down.
Right.
So that's always okay.
That's how I'm able to maneuver now, because before I couldn't even hardly walk.
Okay. Which is a good thing now. Actually, I'll have you stand up. Now, when you were having issues in the neck, I know you were showing me, or like when you have a headache, if you want to just show everybody, because just what you do right now to get a little bit of relief.
Oh, I would stretch my neck like that on both sides, and then it would kind of take the tension off my muscles and
Okay.
or the neck, whatever, and I'd get a little relief.
Gotcha. But still, though, you're always...
Oh, it's always stiff, and it's always like pressure right there.
Okay. All right. Let's go through some ranges of motion. I'm going to have you look all the way up to the ceiling for me. Any pain, tenderness, tightness, pulling?
Tightness.
Tightness, okay. Look all the way down to the floor. Any issues with that?
Just tight.
Tightness, okay. Bring one ear to one shoulder. And then to the other side. Tightness.
I can actually feel the bone rubbing.
A little grinding in there?
Yes.
Okay. And then if you just rotate over either side.
It's sore right there when I do that. Both sides.
Both sides?
Yeah.
Okay. Let's check the lower back. I know that you've been telling me, obviously, years of whatnot of work on there. I'm going to have you just bend forward at the waist for me. Any issues, pain, tenderness, tightness, pulling in the low back or hips?
Just a little bit right here.
Does it stay in that low back?
Yes.
Does it ever shoot down the legs?
No, since they cleaned that nerve.
Yeah, the foramen out?
Yeah.
Okay.
It's been where it doesn't hurt as bad.
Gotcha. If you extend back like that.
Yeah. Did you hear that pop?
Yeah, I did.
Yeah, it just moves around in there.
Okay. If you lean into either side.
Yeah, it's sore, both sides.
Okay. And then just rotating.
Not too bad.
Not too bad. Okay. Let's have you lay face down. And then bring your hands down here for me. Perfect. Alright. So we're going to start off, we're going to scan the body from that cervical spine, going down, checking the leg length, and then we're going to check the symmetry from that right side compared to the left. So I'm going to palpate in on the spine and the surrounding tissue. Let me know if anything is tender to the touch.
Right in there.
Okay, so that's right basically at C7, T1, so we're just getting into that thoracic spine here.
Right in there too.
Okay, so all in that upper thoracic spine.
Oh,
Right in there?
that actually hurt all the way to my lower back.
Did it?
Yeah.
Okay, so that's right in that mid back, and you felt it. Was it on both sides?
which went right down into the center.
Okay. Alright, so he's feeling issues from that mid-back one right down. And that lumbar spine as well?
Yep.
Okay, so we're definitely finding some sore spots while we're making our way down. Okay. I'm going to push in on that right SI joint. Any pain there?
Not too much.
Okay. Directly over the sacrum? Or...
Oh, right there.
Okay, so over that left SI joint we're getting some issues. We'll come down here. Let's check that leg length out. So he pulls short on that left side here, as you can tell. Now when we scan up the body, so there's actually... Hips are looking good, but there's two spots here. So when I scan up, it's a little bit raised here, and it was a little bit raised right here. So we got this one lower, this one a little upper. So I want people to see what's going on there. So when I'm seeing the raised muscle here, what's happening is the spine is rotating. It's rotating to the left, which is allowing the TPs on that right to pull up, and it's going up on the left here. So honestly, what's happening, his spine is like almost twisting. Well, not almost, it is. It's twisting like this. So the left side's up.
It feels like it's a little better.
Let me have you cross the left over the right. I want to do the first set. If there could still be just a little bit of tension in there. So let's get a couple in here. There we go. And drop back to normal. Good. Raise that left leg this time. How's that feeling?
That's better.
Another right. Good.
Mm-hmm.
Lay on your side, face me this way. Perfect. I'm just gonna drop the shoulder down. There we go, just like that. And you bring that out right there. Good. Flip to the other side. Good. Flat on your back. No, on your back, on your back.
Oh, my back, sorry.
Yeah, you're good. From here, we're gonna do leg pulls. You'll feel some release in the ankle, the knee, going up to the hips. Just relax your leg for me, okay?
Mm-hmm.
There we go. Good. Alright, let's have you stand up. This is one that you're going to need. Now we're going to have to do this a little bit differently. No laughing.
Because I'm so tall.
Stand right here.
Hey, we've got those chairs you can step on. Oh gosh.
Okay. I'll have you step a little bit forward because I want you to lean back on me a little bit. Bring your hands up and over mine. Come back. Bring your elbows, squeeze your arms together. Good. Alright. You take your seat right here. Listen that way. I said don't laugh.
That was the funniest thing I've seen all day.
5'7", 6'6". What do you expect? Alright. Bring one arm up and over. Okay. Deep breath in. Exhale out. Good. Stay down there.
I'll stay down there.
Stay down there. Now we're going to do that wide strap.
Alright.
You're going to feel this decompression. Now this is going to be where you get that relief. A ton of relief from. Granted, the wide strap is not beard friendly.
Oh! Wow.
Breathe. Okay, relax. You don't gotta
That
go
jolted
nowhere.
down in my lower back.
Told you that goes all the way down.
Oh my goodness.
Yeah, just relax, relax. Now, the question I always ask everybody, how would you describe that to someone who's never had that done?
Intense. Amazing.
Good. Yeah. It's a powerful move, like I told you.
Yeah.
Probably a little bit different than what you've ever had before.
It feels like it all just went back to normal.
Good. There we go. Turn and face this way. Now you remember in the beginning I had you look up, look down,
Yeah.
to the sides. I'll have you stand up. Let's go through that again.
Okay. That's better.
And then looking down. You notice a difference?
Yes.
Good. And then leaning into each side.
Yeah. It's not nowhere near as
Why
tight.
you didn't have an issue? That I don't think bothered you
No.
last time.
No.
How's that numbness?
I don't feel it.
What was that?
I don't feel it now. I don't feel the numbness no more. That's amazing.
Good. I'm trying to think. What else did we have going on? Any headache going on right now?
Headaches. No, I don't feel it. I mean, you'd have to let me to go through the day a little bit longer, but I don't feel one right now, no.
Good. Didn't you have the start of one a little bit ago?
Yes.
Before the adjustment?
Yes.
Alright, and now there's nothing.
I don't feel it.
Okay. Low back. Bending back. Bending forward. How are things feeling?
It's good. It's always going to be tender down there, but
Correct.
it's way better.
Good.
Yeah.
Yeah, I know this was really bothering you up top.
Yeah.
That left side kind of going into here.
It was like I said, I couldn't even sleep. It was just so intense.
Gotcha.
I think it's way better. It's like I can even move my arm now.
See, before, I mean, you come in and it's like, I know you've seen the videos and you're like, I don't know, think that's what I need, but I don't know. And you see all my patients, when they get up and off the table after the Y-strap,
Yeah.
they're literally like the shock on their face, and now you finally get to experience it. And,
It was awesome.
yeah, you see why, even in just one adjustment, people get that much change.
Yeah. Absolutely. I can't wait for the next one.
Perfect.
Thank you.
You're very welcome. Alright guys, as you can tell, even the pain, the headaches, there's no reason or no need for you to deal with it and live with it. As you can tell, it's as simple as, that one adjustment cleared everything up.
Right.
When you truly take the pressure off the nerves and allow the body to function and to heal,
Right.
that's the state, that's where your body needs to be.
Right.
So, yeah, I know.
Definitely not in pain.
Yeah, definitely not in pain. If you have pain, that's an indicator that something is wrong. Just somewhere something is wrong. So, granted, you have little aches and pains. It's normal life, bending over, working out, whatever it is. But when they start getting chronic, and in your case, that was going on for a while, and that numbness, that tingling, none of that is normal. It's common, but it's not normal to have it. Not everyone. I don't have that pain. So it's not normal.
Right.
But
Right.
yeah, as you guys see, there are ways to alleviate, your problems and your issues. And honestly, going right to the website, drjosephcipriano.com, schedule an appointment, and I'd love to help you out as well. Have a good one, everybody.